The diagnosis of a yeast infection is generally pretty straightforward based on the symptoms of itchy, white, curd-like discharge. Your physician in the office can do a simple little scrape and look under the microscope and see budding yeast on exam. In resistant cases or recurrent cases, a yeast culture could be obtained. The treatment of yeast is usually pretty straightforward as well. There are a number of over-the-counter as well as prescription vaginal yeast preparations. There's also oral therapies. And in resistant cases, sometimes we'll actually use compounded boric acid in a gelatin capsule, but that would be something you would need to see your physician about. We also like to encourage women on the appropriate vulvar care to reduce those infections, and also a healthy diet that's not high in simple sweets and sugars, because that's going to promote yeast infections. The problem with maybe self-diagnosing or self-treating yourself with a yeast infection is you might have something else. It could be trichomonas, could be bacterial vaginosis, could be a sexually transmitted infection, could be a hormonal imbalance, could be a skin condition. So it's important to see your healthcare provider to first get diagnosed. After you've been diagnosed, if you're otherwise healthy without complications, you can potentially self-treat after you've initially seen your healthcare provider. Untreated infections are an irritation and sometimes can lead, to excoriations and ulcerations in the skin and the genitalia. And unfortunately, occasionally, women can have severe allergic reactions to the over-the-counter yeast creams. Not so much the medication, but just the vehicle that they put the cream in. And I've seen some women who have their yeast infection treated, but then they get a severe allergic reaction on top of it. So anytime you have pain, burning, discharge, or particularly if there's something different after a new sexual partner, you really do need to go in for an exam and cultures. Generally speaking, people don't have to change their sexual practices with yeast infections, although when there's the active infection with pain and discharge, it's better to abstain. If a woman's partner has diabetes and is uncircumcised, sometimes that can make her more likely to get a yeast infection. But it's generally not considered a sexually transmitted infection.